feedback. Tell me, like, when you signed up for our consultation group, like where were you at? What were you looking for? And then what have you gotten from the group and from the training program? Because then you shifted over.
Yeah, I would say it boils down to two things. The first one was community. I work alone, and I really wanted that community feel. And the second was really good clinical skills that helped me deepen my practice. That was something that I was just really yearning for. And I felt like before the consultation group, I was on the precipice of that. And I would like get to this state and just be kind of unsure, how do I deepen in from here? And your group has really allowed me, one, to have the skills of how to do that, but I think more importantly, the confidence around it. Because what I found too is, especially with something like IFS, having the confidence to deliver that, clients feel that confidence and are much more receptive to it. So I've really felt, and it builds over time, right? So like the more you do it, the more you see a good outcome, the more confidence you have. And it's little, I feel like I pick up things that feel small in the consultation groups that I then apply to big effect. So it's not necessarily like a huge, transformational piece of wisdom. It's kind of just like something that somebody else says or something that you drop in, or like, for example, that parts mapping worksheet that we talked about. Like I've been sending that to my clients and it's been so helpful. So it's just like small things like that that actually really have pretty monumental impacts. And I just feel like I pick up like 2 to 3 of those per consultation group, and they have a really big impact. And that's amazing for me. It's amazing for my clients. So yeah, I think it's been incredibly helpful.
How do you feel that I know from like feeling the shift in confidence, what does confidence feel like? I'm just curious. Like when you feel that confident feeling, what does it feel like that you're like, oh, I think I have more of that, or I feel it?
Sitting in silence is something I've never been able to do. I certainly feel a shift with that. Tolerating clients' discomfort and helplessness without jumping in to save. Really kind of operating from a place of groundedness. Like I have an intervention point, I have three to four options, and I kind of see them in my mind, and I'm able to choose which one from a calm place as opposed to like a frantic place. So it kind of feels, like level-headed, even-keeled, and that energy has a big impact on my clients because, of course, like that co-regulation is so important. So I would say those are kind of like the most noticeable shifts for me.
Yeah, it's almost like from a calm place being like, let's try this. And if it lands, great. If not, that's fine too, versus like this insecure part of like, we have to try this, or this is like where we're going.
Yeah. And if it doesn't land, it's okay. It doesn't ruin my day. It's kind of more like a learning as opposed to I'm an imposter and I'm not a good therapist.
Yeah. Yeah, that's right. That's like part of the confidence. What would you say like is your favorite part of like the group? And what would you say to someone who's like considering like joining the program or the group?
I mean, I think you have an amazing abundance of wisdom. And I feel like osmosis when you speak, like I kind of just take in everything that you say. And there's always some nugget that's just like this golden nugget that I take with me. So I would definitely just say like your presence and your wisdom. I think the way that you conceptualize cases has been really helpful for me to see. What you notice, what you pick up on, what you pay attention to, and what you stay with. I feel like I've learned a lot from that, just in terms, because complex trauma is so hard to conceptualize. You have so much thrown at you at one time. Having the group to have camaraderie, community, and also wisdom from other group members. That was something I wasn't expecting. I feel like there's so much crossover in cases. So like even when somebody else presents, there's always some crossover that I am seeing in my own caseload, and I can receive feedback even if I'm not actually talking. because the case has some similarity. So I find that whenever I'm in group, I receive something beneficial.
Mm,
And I think when it comes to like bang for your buck, so to say, that feels huge for me. If I can leave every meeting with something new to apply or some new insight, that's very worth it to me.
mm, yeah. And then I would ask you, because we were just talking before about like your shift financially in terms of, I know we were talking about like the support of me and the group, like supporting you in terms of shifting over to private pay. And I know how I was saying, like, I support therapists in deepening their work. And then do you think that your investments in this program and other programs have allowed you to then charge your worth and really give your clients? I know you were just talking a little bit about that.
Mm-hmm. I do. Yeah, absolutely. It's tough to put my finger on what it is. I think just having the ability to bounce ideas off of like-minded people who are charging similar or higher rates allows me to have more confidence in my ability. Like, I don't feel like I'm behind when I'm in this group. I actually feel like pretty on par, and that gives me confidence in terms of charging. And yeah, I appreciate you saying I have clinical wisdom. It's the feedback is really helpful too, because I'm
Yeah.
not in school and I work alone. So just having that
Yeah.
like positive reinforcement is nice.
Yeah. It's almost like when Caroline, were you there when Caroline said, the one from Ireland was saying how like when she sits in complex cases, she almost feels like she has her net of like therapists who like she comes to consult with. It's like that confidence of like you have your group, you have your community of other people who are very deeply wise, like we all respect each other, and you have that input, right? Like support you. So it's not like you're doing this alone. And you have that like people calling out the blind spots. They're just holding like the intensity of what we hold, like you said, in complex trauma.
Mhm.
And if somebody was thinking about joining the group, like what would you tell them? What could they expect to get out of it? Or yeah.
I mean, the course is so well thought out and so deep, and it covers so many areas. I would just say like the deepening of your clinical skills is just going to be immediate when you go through that course. And I don't have time to go through all of it. I kind of like, I feel like I have things that come up and then I check the course and then I
Yeah.
just see what I can take from it. But the content in that course is, I think, invaluable.
Mm,
And then also the community feel, just bouncing ideas off of other people and having validation, having a forum of people to go to when life is stressful, especially
yeah.
with complex trauma clients. I think
Yeah.
that's really, really invaluable. And I've noticed in myself, like the projection and transference that can come up with really complex cases is pretty intense. So yeah, having that community to just talk that through with is really great.
Yeah. It helps us like lessen like isolation and burnout. Um, and if people are looking to find you, I know I was just telling you I'm going to send some clients to you because I'm full right now. But if people are looking to find you, what's the best way for people to get in touch with you or your practice?
So I have a website. I can email it to you, and my email, I think you should have too. It's saskiaharristherapy@gmail.com. So those are the two best ways.
Okay, so I'm going to put your information